What is the difference between FUE and FUT hair transplantation? Well, first I'm going to start off with FUT because it is the earlier iteration of the hair transplant. But what I want you to know about these two methods is that they only refer to the method of extracting hair from the scalp and not the method of implantation. So let's start with FUT. FUT by itself stands for Follicular Unit Transplantation, which is a term that's quite confusing. So I want you to forget that and let's call FUT the linear strip method. The reason we call it the linear strip method is because how you extract the hairs is a little different from FUE. In the linear strip method, what the surgeon does is create a cut on the back and sides of the head, usually about 1 centimeter, and then they create this long ellipse of skin. They take out the skin with the hair. They then suture the scalp together, so you are left with a long linear scar. They take that piece of skin with the hair follicles. Those hair follicles are then processed and then they're ready for implantation. That's FUT. FUE is a newer iteration of the hair transplant, and how this works is that every single one of those follicles are individually targeted with a rotating punch. So instead of creating a long linear scar, you get tiny little dot scars where the individual follicles were harvested. Now, let's talk a little bit about the pros and cons of each. Well, in my opinion, FUT really only has one pro, and that is that it can potentially extend the life of the donor area. So maybe if you do an FUT first, it can give you about 15 to 20% more follicles to harvest because it doesn't create this uniform lack of density. You only get a lack of density in that one thin line that is the scar, which if done correctly is hardly visible. But I do prefer FUE, and the reason I prefer this is because number one, there is a lot less downtime. It's a lot less painful. There's a lot less chances of any sorts of complications. I've seen so many terrible FUT scars that I've stopped doing the procedure altogether. Patients can wear short hair because with FUT, people can see a long linear scar, so you have to wear your hair a little bit longer. And let's not mention some people, especially young people, just heal badly from it. So FUE is superior in most cases, although a small FUT for females is something that I would still do. Typically, I go FUE all the way for every single surgery. So I hope that helps, and if you have questions, we're going to do our best to answer all of them.